Well, tucked inside the One Big Beautiful Bill Act that the U.S. president signed in early July is new funding for rural health care. It's called the Rural Health Transformation Program.
It's a $50 billion one-time funding program aimed at improving health care access in rural communities. But will it move the needle on transforming health care?
There is our Washington, D.C. correspondent, Rachel Knapp. She's joining us live right now. Rachel, you spoke with health policy experts about this. What are they saying tonight?
Well, good evening, Mike and Eva. So rural communities face a lot of health care related issues, from staffing shortages to hospitals getting underpaid. Now, this program is one of the largest investments in rural health care, but with the estimated cuts to Medicaid from that One Big Beautiful Bill, health policy experts say it's not going to be enough. The Rural Health Transformation Program is a new $50 billion funding program created from the One Big Beautiful Bill Act. Half of that money will be distributed equally among all 50 states. And for the other half, the Centers for Medicare and Medicaid Services will have broad discretion over distributing the money after states apply for it.
This program's major focus is to deal with the folks who are most vulnerable in rural America, because for them, having insurance isn't the big challenge usually. It's getting access to care.
Experts estimate the One Big Beautiful Bill will reduce federal Medicaid spending in rural areas by $155 billion in the next 10 years. The reduction will not only have an impact on Medicaid beneficiaries, but these changes could negatively impact rural hospitals and rural healthcare consumers. This new program is supposed to act like a safety net, but health policy experts say it will fall short in the long run.
It's an important investment to do innovation, infrastructure development, workforce investments, but there is concern that $50 billion won't be enough to offset what are the anticipated losses to payments in rural communities.
Already had a rural health system that was challenged, and then you put $150 billion cuts on top of that system. That's going to make those challenges even more acute. I've already started to see some hospitals and clinics close around the United States. The main thing about the big bill is it's expected to lead to many people dropping Medicaid coverage. Just to put this in context, there are many rural hospitals and systems that rely more than 50%. I've seen numbers as much as 60 to 70% reliance on Medicare and Medicaid.
Now, Mike and Eva, another concern about this is that this is just a one-time fund. It's not reoccurring money. Dr. Mehmet Oz, who is the CMS administrator, was asked about that, how he's going to make sure that rural hospitals and healthcare systems are going to be able to be viable after this money is up. He said that the part of this program was created, is supposed to be big but limited. He adds, quote, "We don't want to create a new pathway for people to get money sent to the systems that are not viable as they are," end quote. He adds that he hopes with this program that they hope to train enough people and create enough systems that are independent of their presence in the marketplace that will make these healthcare systems viable and healthy. Mike and Eva, back to you.